This is the Emergency Medical Minute, brought to you by HCA Health One.
Today's medical minute is going to be on heart transplants and some of the pearls to know about that. When you have a patient who comes in with a heart transplant, there's just a couple of important conditions to keep in mind and some nuances to their pathophysiology and presentation that I think are kind of interesting and something to think about. So one is going to be dysrhythmias. When you get a heart transplant, you have to cut the vagus nerve, and so they don't have any vagal tone. So they are kind of like always, very often are going to be tachycardic, and that also means that they're going to not have any response to atropine, but they're going to be fairly responsive to adenosine. Additionally, their tachycardias can be caused by allograft rejection, and sometimes a push of 500 of methylprednisolone can help abate that, but you do want to talk to transplant surgery about that if you can. Additionally, just overall rejection is the big thing that we worry about, right? It's a foreign tissue. Their immune system will attack it, and that's why we give them immunosuppressants. When that happens, they can go into something that just looks like heart failure. So troponins would be bumped, BNPs would be elevated, looks like pulmonary edema. And they can also get coronary allograft vasculopathy, so that would kind of look like coronary artery disease. So that's just an interesting way it can kind of manifest. And again, since the vagus nerve is cut, they can't feel it. So if you have a patient who's having a heart attack, right, the chest pain, shortness of breath, that's the typical complaint. But when that nerve is cut, they don't have that sensation. So their complaints are like really vague. It's weakness, it's fatigue. They're not going to really complain of chest pain, which I think is kind of interesting. Infection, right, any patient who's on chronic immunosuppression is going to be at high risk for infection. Those patients are going to be most commonly getting those after the first few months of a transplant, and they're also more at risk for some more obscure infections, so like CMV, Legionella, tuberculosis, Cryptococcus. Those are all possible. And then medication side effect just from all their immunosuppressants, so calcineurin inhibitors, mycophenolate, those things can cause AKIs and pancytopenia respectively. So just some pearls about that. Lastly, also a donor heart might not be the same size for their body, so they might just have like a weird, enlarged heart just because it was a larger person that donated it to them. And so, yeah, always kind of interesting kind of features of it. So
This has been the Emergency Medical Minute. Thank you for listening, and thank you to HCA Health One for their financial contributions. Support from them and from listeners like you helps us achieve our goal of spreading free education to the masses. If you'd like to help, please donate. Follow the link in our show notes. Thanks for listening.